cannabis, but there are some caveats, there are some things to think about. It's not a cure-all. A lot of times I've heard a lot of different claims saying it'll do this, or it'll do that, or it'll do everything, or it'll fix everything. But that's not the case. While the endocannabinoid system is a deeply integrated system, and while there are a lot of potential therapeutic effects, and we're really just scratching the surface, we want to make sure that we realize that it's not a cure-all. There are a lot of things it's excellent for, but it is not good for absolutely everything. What we need to think about cannabis and CBD, the way that we need to approach it is that it's an additional tool in our toolbox when it comes to medicine. It's not to say that pharmaceutical medications are bad, because pharmaceutical medications certainly have a lot of applications. And for a lot of applications, they're going to be much, much better than cannabis. For example, if you have low thyroid, cannabis is not going to fix that. You need thyroid supplementation. If you have diabetes, you're going to need insulin. Cannabis is not going to fix that for you. So I want to make sure that people are aware that it's not a cure-all. We need to think of it as an additional modality that we're able to utilize when it comes to medicine. Now, there is species variability when it comes to endocannabinoid systems. Even though animals have similar endocannabinoid systems to humans, it's not exactly the same. The most striking example is in dogs. When it comes to the CB1 receptors, which is what THC interacts with, dogs actually have the highest concentration of CB1 receptors in their cerebellum. The cerebellum is responsible for coordination and muscle movement and balance. And so that's why whenever dogs get into too much THC, you'll see that they have what's called static ataxia. They'll sway, they'll stumble, and that's because they have a high concentration of CB1 receptors in their cerebellum. And this doesn't appear to be the case for a lot of other species or humans, but it does appear to be the case for dogs. So we have to always consider that when it comes to different animals, that their body system is going to be similar to humans, but it's not going to be exactly the same. There are going to be some differences. The last one.
A lot of drugs like all your statins and stuff like that, they're likely to be effective.
Yeah,
and I suspect there's more than reversible competitive inhibition. There's obviously kind of as well.
Yeah, we're really just scratching the surface. So this is an area that's actively being explored. In terms of discussing cannabis with veterinarians, a lot of people have probably tried to discuss with their veterinarians, and we encourage them to do that because this is medicine and it affects their health, their pet's health and the quality of life. And so, your primary source of veterinary knowledge is going to come from your veterinarian. But a lot of people have received pushback because their veterinarians don't feel comfortable discussing it with them, or are not able to, or simply don't know enough about it. One of the major reasons is because, according to California law, and this is the case with many other states, is that California veterinarians are actually not allowed to discuss cannabis with their clients, which is really, really unfortunate, because what clients are seeking is they're seeking medical information from their primary medical source. And if they're not able to get that, then there becomes a gap in that knowledge base, and that forces owners to seek out that medical information from other sources that potentially may be erroneous or incorrect. But AB 2215 is a California bill that passed both the Assembly and the Senate, and it's actually sitting on the governor's desk waiting for his signature. And what this bill will do is allow for California veterinarians to discuss cannabis with their clients. And it doesn't allow for recommendation or prescription, but it actually does allow for them to at least discuss cannabis with their clients. And so that's a first step. Even though a lot of people feel the frustration of not being allowed to discuss, that we discuss with our veterinarians and more that we discuss with each other, the better we'll be able to improve not only the lives of people, but the lives of animals that we share this planet with. A quick little blurb about us and what we do. Like I mentioned before, I'm the founder and CEO of VET-CBD. We make medical cannabis products for animals. We are veterinarian formulated. We do have veterinary nurses on staff to help answer people's questions. We understand that a lot of people have questions about cannabis and how it's used in pets, and so what we do is we have veterinary nurses that help answer our emails and our phone calls, so that whenever people have questions, they're able to talk to health professionals about it. We are considered a cannabis product. We do have small amounts of THC in our product, and so we are sold through the California legal market through California dispensaries. And with that, I'll open the floor to any questions.
Recently, seen some CBD products for at the food companies for dogs and cats. I'll ask them.
Requirements, for example, like Amazon won't let products have CBD on it, and so that's why a lot of them will label it as hemp oil extract, phytocannabinoid-rich hemp oil. And the other thing that the market is going to have to take a look at is now that plant-derived CBD has FDA approval for Epidiolex, what's the implication of that for other hemp CBD products? And that's something that remains to be seen. And that's something that remains to be seen. So, arthritis.
What was the question?
Does it help with pain relief from arthritis? With arthritis, there's a lot of inflammation and pain going on with the joints, and we found CBD and cannabis to be remarkably effective for that because we don't have a lot of good options for chronic pain control, especially ones with minimal side effects. But we have seen a lot of improvement in dogs and cats and birds and other species using it for chronic pain relief for things like arthritis. A study done a few years ago that showed that dogs with skin allergies had an upregulation of CB1 receptors in their skin cells. So there's absolutely potential for topical use. One of the difficult things is to figure out the dosing of that, because when you're applying it topically, you have to figure out how much is getting absorbed. Now we actually have seen a lot of patients get relief from skin allergies using oral ingestion. So, while the topical avenue, that is an active area of exploration, we have also seen patients use it for skin allergies through oral ingestion.
Are you dosing it?
0.25 to 0.5 milligrams per kilogram as a general guideline for animals. Now, it can range because species can be different, and even within the same species, for example, some dogs can be more sensitive. Some dogs may not need as much, some dogs may need more. But it also depends on their conditions. For example, for anxiety, they may not need as much. Sometimes in seizure patients, we've actually seen them need more. Sometimes we can get away with using it once a day, sometimes we have to use it 3 times a day. So we have to keep in mind that each patient can vary, and it can be very different for each patient, even if they have the same conditions.
So do you start at 0.25, but then the next day you go to 0.5, you go to double the dose, with humans, a lot of people will titrate up. Are we trying to do the same thing with animals?
No, we generally find the dose that they're good at, and then we stay at that dose. We generally don't need to titrate up.
With the cats, you said primarily a tincture, but do topicals work at all, or is that too much for?
Potentially, that's an active area that we're looking at. So there is definitely potential because we do know that there can be absorption of cannabinoids through the skin. So most likely,
But
it
what
can work.
what if they licked it? Because that's what a cat's gonna fucking do.
Yeah, I mean, make sure that it's safe for oral ingestion. That it's all about the formulation.
Cool. Okay. Thank you.
Why did you decide to go through the legal cannabis market rather than using industrial hemp?
So our product actually has THC in it. So the reason why is because of the whole thing about because species can be different, and even within the same species, for example, some dogs can be more sensitive. Some dogs may not need as much, some dogs may need more. But it also depends on their conditions. For example, for anxiety, they may not need as much. Sometimes in seizure patients, we've actually seen them need more. Sometimes we can get away with using it once a day, sometimes we have to use it 3 times a day. So we have to keep in mind that each patient can vary, and it can be very different for each patient, even if they have the same conditions.
So do you start at 0.25, but then the next day you go to 0.5, you go to double the dose, with humans, a lot of people will titrate up. Are we trying to do the same thing with animals?
No, we generally find the dose that they're good at, and then we stay at that dose. We generally don't need to titrate up.
Okay.
With the cats, you said primarily a tincture, but do topicals work at all, or is that too much for?
Potentially, that's an active area that we're looking at. So there is definitely potential, because we do know that there can be absorption of cannabinoids through the skin. So most likely,
But
it
what
can
if
work.
what if they licked it? Because that's what a cat's gonna fucking do.
Yeah, I mean, make sure that it's safe for oral ingestion. That it's all about the formulation.
Cool. Okay. Thank you.
Why did you decide to go through the legal cannabis market rather than using industrial hemp?
So our product actually has THC in it. So, the reason why is because of the whole thing about full spectrum versus isolate, and THC does have clinical applications in it. Yeah, like I said, we'll leave that to the lawyers. Yeah, they love discussing that. I know that we've got a couple questions.
Would you recommend starting a younger, healthy pet on this as just a daily care before there are ailments, or wait till there's?
Yeah, so we don't see any indications for using it just for general purpose like that. Hi, my name is Dr. Tim Shue. I'm the founder and CEO of VET-CBD, and what we do is we make medical cannabis products for animals. We use it for a variety of reasons. A lot of people are familiar with medical cannabis use in people, but not everyone realizes that we can also use medical cannabis safely and effectively in animals as well. So a lot of the different reasons that we use it for are especially for pain, especially when it comes to arthritis. We use it for nausea, we use it for inflammation, we use it for anxiety, and even for seizures. A lot of people have heard about seizure use in children and the seizure relief that they get from cannabis, but we see the same thing in animals as well. Animals can definitely benefit from cannabis, and we are veterinary formulated, and we are veterinary nurse supported, so anytime anyone wants to find out anything about cannabis and how it can be used in pets, they can always email us or call us, and we have veterinary nurses that can help answer their questions. You can find us by going to our website, VETCBD.com. We are sold in California cannabis dispensaries throughout the state of California. We have a locations tab on our website that you can click on, punch in your address, and it'll show you all the dispensaries nearby you that carry us. We're here at CBD Expo West with Cannabis Channel on Roku.